I'm Teresa Reed. Welcome. I'm a member of the Brews and Views Committee of the League of Women Voters of the Ann Arbor area. Before I introduce tonight's topic and guest, I want to fill in a blank I left last month when we heard Professor Eli Rubin's impressive presentation on Medicare for All. That program was brought to us by two active league members, Jackie Wolf and Sue Smerick. We would not have heard from Professor Rubin without the advocacy and connections of Jackie and Sue. So thank you, Jackie and Sue, from all of us for fostering that really amazing program. Frighteningly enlightening. So our topic tonight is Washtenaw County's pandemic response. The COVID-19 pandemic has presented once in a century challenges to every level of government in the United States. County public health departments are at the front line of defense, especially for citizens who lack access to reliable health care. Washtenaw County is fortunate to have an outstanding Department of Health staffed by well-trained and dedicated public servants who at this point are pretty tired. As US President Joe Biden aims to vaccinate 1.5 million Americans a day, the League of Women Voters brings you this program to inform you about how our health department is handling the enormous challenges generated by the pandemic. Our guest is Susan Ringler-Cerniglia. As Director of Communications for the Washtenaw County Health Department, Susan Ringler-Cerniglia has been called the storm tracker for the COVID-19 pandemic in the county. The prolonged crisis has generated a grueling workload for all health department staff as they strive to respond to the community's cascading needs. Among Ringler-Cerniglia's chief responsibilities is to keep citizens informed. To do so, she draws on data from federal, state, and local sources to update the county's COVID hub daily. A Western Michigan native and graduate of Kalamazoo College, Ringler-Cerniglia earned a master's degree in public health from the University of Michigan and has worked for the county for 14 years. Susan, welcome.
Thank you. Very glad to be here. Thank you for having me. And that was a really wonderful introduction. Thank you. I would agree wholeheartedly that we're all very tired, but we are still working very hard and doing our best to get timely and appropriate information out in a variety of ways and hopefully useful ways. So as was said, my primary role is communications. I do in normal non-COVID times also oversee what we call our health promotion division. And that includes a lot of responsibilities for programs, grant writing, development, many other things. But of course, what we're going to talk about today is COVID. So I have prepared some slides of common questions that we get, especially where we find ourselves right now in the response, very focused on vaccination. So I'm going to go through those, and then I think we will still have plenty of time for questions after that. So I'm going to go ahead and share my screen and
works fine here.
Perfect.
All's well that ends well. Okay, so I was focusing on this idea that, you know, the vaccine is, of course, one of our tools, and we do, in fact, need to keep using all of those tools, you know, to get through this. So that includes our masking, our physical distancing, our hand washing, of course, that isolation and quarantine if you're exposed, if there is a case, all remain incredibly important. The vaccines are also very safe. We hear a lot of concerns from folks about the speed at which they were produced. And we like to make sure we're reinforcing the fact that what happened to develop these was really an incredible global cooperation effort. And the waiting that got taken out of the process was really that. It was about the waiting and the financial insecurity but the safety steps and the testing and the rigor that vaccinations go through before they are given to the public, none of that was compromised or skipped. So we like to make sure that people are hearing that message. As folks probably have also realized, there's no cost to these. They've been purchased by the federal government and they're being provided free of charge. Some providers are allowed to charge an administrative fee, which health insurers will pay, but there should be no cost in any of those scenarios for the individual. The two current vaccines we have available, the Pfizer one and the Moderna, have slightly different processes and how they're administered and the number of days that the second dose is administered after. They both require 2 doses. Storage and handling is slightly different for both of those. And we are also seeing what we call basically mild side effects from a lot of these. And those are generally good signs because they're a sign that your body is having an immune response. So it's not considered illness, but it is mild symptoms that feel like that illness, but much shorter. So localized reactions might be that soreness at the arm, might also be fatigue or slight fever or other types of symptoms that are really short term. So maybe the day after you're vaccinated, you might feel a bit punky and then hopefully be back to normal. A little bit about how that distribution is happening in Michigan and for us locally. As hopefully folks might have heard, there is a goal of having 70% of all Michiganders vaccinated by the end of this calendar year. And of course, we're only at the very beginning of this calendar year, and we are just getting going really on vaccination. And we also within that, there are some timetables like we have listed out here of really turning around all the vaccines that are given to us on the local level very, very quickly. So there's been a bit of confusion about how that works with first and second doses and whether those second doses were being held back or stored. And that's not really how it works. What happens for us, for example, locally, is we get our vaccines in each week. It's truly a week-to-week thing. We find out on Fridays how many we're getting that next week. And we take that amount and we take out the number of second doses that are needed for that coming week. And then the rest is divided up according to priority groups. And then we have to do all the scheduling and siting and logistics to give that out in the coming week. And if you've been to, any of you that might have been to our clinic or seen some of the pictures of the setup, there are a lot of logistical details that happen around that. So really what goes on is that each week we are prepped and ready in terms of our staffing and space to be able to give a large number of vaccines. And if we don't get that full number, we pull back on some of that staffing and only give the ones that we receive. But we absolutely have to be ready to get all of them into eligible people that following week. Okay, we are cautiously optimistic that our supplies are going to increase. We haven't quite seen that locally. We've been at a steady amount of a few thousand doses per week. But as I said, it is, in the scope of things, still very early in the process. As the local health department, our job is to support what's called this emergency vaccination distribution. In other words, it's not really the normal way that you might get a vaccine, right? It's not necessarily from your healthcare provider or pharmacy. And it is set up, again, because of the limited supplies in this centralized, large site with many people coming through quickly, what we call a mass vaccination site. So a little bit more on that initial distribution and what that looks like. So health department, us in the far right there in the green, what we've been really focused on is our healthcare workers at this point that are not affiliated with one of the large systems. And in Washtenaw County, that healthcare worker group is really a very large population. So it's taken us a while to vaccinate that group. We're also now, as of mid-January, that we opened up into the next group, vaccinating adults 65 and older, and particularly those adults without a healthcare provider already, and focusing on those specified essential worker groups, as well as some of our other vulnerable settings that haven't been covered. So I'll tell you a little bit more about what I mean there. So if we look at the pharmacy category, most folks have probably heard now that there was a partnership with a couple of the national pharmacy chains, Walgreens and CVS, that they were provided with vaccine by the federal government, and they were charged with going to long-term care facilities. So that rollout started about the same time as vaccines started to be available to health systems and to health departments. The other gap that we're covering at the health department is other types of facilities that weren't covered by that partnership. So if it was a licensed long-term care facility that was vaccinated by CVS or Walgreens, then the local health department didn't have a role there. However, other types of facilities, like some of our senior living centers or group homes or smaller type facilities, we have been sending mobile teams to vaccinate those settings that weren't already covered. More recently, just this last week in the news, the federal government has announced that they will be sending vaccination this week to a few other pharmacies, and that includes in Lower Michigan, Meijer and Rite Aid. So we are expecting those facilities to start having vaccination. What we don't know at this point is actually which Meijer locations. At least as of yesterday when I looked, we haven't seen that Meijer or Rite Aid has specified which stores. They do, however, have a registration process that people can get on their waiting list to find out more. And we, unfortunately, as a local health department, don't have more information about that, other than that we know those are the two pharmacies that are contracted to do the work. Our middle chunk here is our hospitals and health systems. So our big regional health systems that are located in Washtenaw, including Michigan Medicine and St. Joseph Mercy Health, both received vaccine initially to get their frontline healthcare workers vaccinated. It's been a little unclear moving forward whether they would continue to be supplied and to continue vaccinating patients that were 65 and over. We saw that happen in the first few weeks, and now that supply was never very large, but is now sounding like it's going to be shifted more to the health departments. Our health systems are still very willing to coordinate with us and have been coordinating with us. It's the supplies at this point that are more than a bit unclear. So we had been moving forward with this. And you may have seen also today, we actually announced a partnership with St. Joseph Mercy of Ann Arbor, that they are joining us at our mass vaccination site locally, which is at EMU Convocation Center. So St. Joe's will actually be providing a portion of that staff and working directly with us at that site starting in the next week or so. So right now, because of supply, that doesn't mean that we have that we necessarily have more appointments. However, it does mean that we have capacity to give many, many vaccinations as soon as we have that supply available. So that's good news as far as us being in a position to get that vaccination as soon as we can get more supplies in, to get it out very, very quickly to folks that are eligible and ready. So this is a slide from the state health department that folks may have seen, and this is really the preliminary and expected timeline. So you can see in the beginning of this timeline down in the bottom, in December and January is when vaccine first started rolling out and is focused on that first group of healthcare workers. And that also included the long-term care residents and staff, as I mentioned, through the pharmacy partnership. So we get to about mid-January, and that's when the current eligible group opened up. So people 65 and older, and these specific groups of frontline essential workers that include our childcare and our educators and school staff, as well as a few types of what we call congregate or group living situations. And that includes some homeless shelters, juvenile detention, as well as our first responders that weren't already vaccinated, like our law enforcement and fire and police and that sort of thing. So you can see from the length of time that we're expected to be in this phase that we are really in the very, very beginning of that. And and we sound like broken records asking for patience, but we really are just beginning that group. And of course, our supplies are very limited. And so someone that is eligible now, you can see from the timeline, it may be several months before we actually get through those groups. And then of course, the next group to come online, which we're looking at May, is all the rest of the groups that are considered frontline essential and folks with underlying health conditions. And after that, we move forward into other essential workers, and finally, really August or September, anyone 16 or over. Okay, so a little bit more about those priority guidelines, because we know we get lots and lots of questions about those. First and foremost, they are set at the state level, and they are also based on federal or CDC guidance. The approach is meant to be phased, and those phases are overlapping, like we just saw on the timeline. One of the things that we're struggling with locally that I've kind of alluded to here is the sheer number of folks that are eligible versus the number of vaccines that we're getting in. We've estimated that we have at least 80,000 people currently eligible in that second group, that 1B group that includes essential workers and everyone 65 and over. And we so far have recorded about 30,000 requests. So we know, for example, that everyone that is eligible has not yet requested an appointment, either because it's difficult to do online and they haven't reached someone to do it over the phone, or perhaps they haven't even heard about it. So we know that there's a gap there between folks that are eligible versus those that are requested. And at the same time, we know there's increasing frustration on the part of folks that are already on that list and are waiting, for their appointments. That doesn't mean folks aren't being vaccinated. Folks are being vaccinated, a few thousand a week. It's just not enough to make much of a dent in that eligible group at this point. So as I mentioned, we're receiving roughly 3,000 doses a week, about 2,000 to 3,000. About half of that goes to those needed second doses, and the remaining amount is split between the eligible groups. The priority at the state is really that we put the largest chunk towards the older adult population, so our 65 and over. And then it's meant, the guidance is a 2/3 to 1/3 split. So about 2/3 of our weekly vaccine after the second doses, so the available first doses, should be going to the older adult population that's eligible, with the 1/3 going to the essential worker group that's currently eligible. Now, the other little chunk that comes out of that is healthcare workers that continue to be eligible. We're getting close, but we haven't quite gotten through that whole group. We continue to get really kind of rolling requests from healthcare providers, a lot of mental health professionals, dentists, nurses, physical therapists, other types of healthcare providers that haven't gotten vaccinated yet. So we've gotten through a lot of them, but we still do get requests for that trickling in. So that proportion comes out of those available doses per week as well. A little bit about how we're doing that. I have alluded to our mass vaccination site. Currently, that is operating at Eastern Michigan University Convocation Center. They have very graciously been working with us since vaccine arrived in late December. And if you're familiar with the center, there's of course athletic facilities there, but really what we use are these long hallways that kind of go around the athletic facility in this open atrium type area. And that allows us a lot of good space so we can keep that physical distancing between people. And it also allows us to have an area where you come through, get the paperwork checked and filled out. And there's an education station where we reinforce some points about the vaccination and what to expect both during and after. And then there's the actual vaccination. And then you go into a waiting area where we have chairs spaced out at good distances. And everyone is asked to wait at least 15 minutes for observation to make sure there's no concerns. If you're someone that screens positive for a potential allergic reaction, really meaning you've had a past anaphylactic or allergic reaction, then you're asked to wait longer, typically 30 minutes. We have, of course, trained medical professionals on hand as well as paramedics in case anything should happen. We have not had allergic reactions happening, but as folks probably heard with some of the earlier trials, there did seem to be a slightly higher incidence of that happening. So we're prepared for that and ready for that on site. The final thing that happens while you're on site is that we have a way to schedule your appointment electronically. So if someone comes with their own phone and can go ahead and schedule it, great. If not, we have staff and volunteers there to assist with that scheduling so that when you come through for that first appointment, you go ahead and schedule that second appointment 3 weeks later. All the vaccine that's being used at this mass or central location at this point is all Pfizer. So that's all on the same schedule. As we have more vaccine available, we have plans in place to open a second central site. And that will be because our first site is on the eastern part of the county. The second site is planned on the western part of the county. And it will be similar, but slightly smaller, a centralized place where we can put a lot of people through easily and quickly. At the same time, we have what we call our Nurse on the Run team. And that is a mobile team that goes to settings and areas where it's more difficult for people to come to the vaccination site. We're also using this as we move forward for homebound individuals. So for example, I mentioned some of our group homes, some of our settings where like the jails where there, or juvenile detention where there's staff that need to be vaccinated, and also homebound individuals. So that is also a team goes every day, really every weekday, and goes to sites as we have supply and capacity to go. As we move forward and again have more vaccine, we will do more of that targeted vaccination. And of course, doing that, and that's kind of what's on the bottom here, is pop-up community vaccination clinics. So sites where we know there's a large number of folks that are eligible, might be a senior center or an apartment complex. In the case of some of our workers with teachers or other types of workers, that could also be a work site or a community site to get those populations vaccinated. People often ask us about the National Guard support. We do have the ability to ask the National Guard to help us. And right now they are, and they've done this quite a bit with testing sites over the time of the response. And right now we have a number of National Guard staff helping us both as medical and non-medical volunteers at the vaccination site. So meaning if they're licensed to give vaccination, they give vaccination, or they help out in other roles, like as far as supporting people and paperwork and that sort of thing. This is just a little overview of where we're at with the vaccine locally. We are just over 9,000 first doses given and over 4,600 second doses given. And what we try to do each week is update those numbers as well as give an idea of how many appointments are scheduled for the current week. The alphabet soup that you see on the bottom is us really trying to make it very clear who is or isn't eligible for vaccination right now. We get a lot of questions about the numbering and the lettering and why don't we just renumber it? And the answer is that we can't. That is the state priority lettering. So what we've done here is just try to make it as clear as possible, but we can't renumber it. For example, one of the points of confusion is that the group you see labeled 1C Group A, part of that group is eligible, but the 1B Group C right before that is not. And that is because when the state revised and opened up statewide to that larger group of 65 and older, they pulled the folks that were 65 to 74 had been in Group 1C, and they pulled together all of that into current eligibility. So that everyone 65 and older was eligible by age. And that's been a cause of a bit of confusion. So kind of going through these from the left side to the right, our 1A we're pretty familiar with as healthcare workers. That 1B Group A was 75 and older, and that's still eligible, but it's combined with the 1C, which is our 65 to 74. So everyone 65 and older eligible. The 1B Group B is our group that includes the prioritized essential workers, those first responders, educators, police, fire, juvenile detention, those groups. The next group labeled Group C that says not yet is the—
Good, thanks. How are you?
The remaining is—
Perfect, thank you. Can you just press the button up on the top of the— Thank you.
So the remaining essential workers that are not eligible yet. So hopefully that is fairly clear, or as clear as mud, as we like to say.
Susan?
Yes.
With that interruption, I didn't catch the last 30 seconds of what you just said about the slide before. Can you go ahead.
Okay, so I was just kind of going through who's currently eligible on the bottom. So to quickly go back over that again by the groups, that 1A on the far left is our healthcare workers. 1B Group A is our 75 and over. The 1B Group B is our essential workers, select essential workers currently eligible. So our educators, our child care, our first responders, juvenile detention, jail, and so forth. The next group, 1B Group C, that says not yet, is our next group of essential workers that is not currently eligible. So that includes our food and restaurant workers, essential manufacturing, a whole wider group of essential workers. The next one, Group 1C Group A, that says some can, is where the state pulled in the older adults 65 to 74 and combined that really all into one group of older adults 65 and over that are all eligible by age. One of the common questions that we get on this is and really going back to the other side where we saw folks with underlying health conditions that were not quite to that group yet, right? We get a lot of questions about folks that are that are older than 65, say they're in their 70s or their 80s, or they have underlying health conditions, and it's not clear why they're not being prioritized ahead of folks that might be in their mid 60s or don't have underlying health conditions. And the unfortunate answer to that is that everyone 65 and older is eligible by age. We're not looking at this point at healthcare or at underlying health conditions. And if somebody's older within that group, we're not necessarily able to prioritize because everybody 65 and older is eligible. Okay. So this is a little bit about how to schedule and how it is currently working. We are constantly looking at these processes and trying to improve them. One of the struggles that we're having is, of course, that we're building the plane as we're flying it, if you will. These are not platforms and systems that existed. So it's a bit of a challenge to get them up and operating. But the way that we're facilitating it right now is that there is what we call an appointment request that is available on our website. We can also complete it with folks on the phone, and people can also call 211 and they will walk you through the online part of that and enter the information for you as well. So that first step is really a brief survey, an eligibility survey. And so it asks a few questions about whether you live or work here in Washtenaw, and it asks about your healthcare provider, although we are no longer screening out based on that. And then it collects like your phone number and your email. And if you are an essential worker, it asks about the type of essential work. So you get through that survey and it basically tells you, okay, you're completed. That means you're currently eligible. Your request has been successful. So you move into that middle orange part and you are in line. Now, the unfortunate part of this, again, as we talk about supply, is that it literally may take weeks or months for you to get an appointment. We get a lot of calls and emails daily for folks asking if we can tell us where they are in line. And unfortunately, we just can't, in part because we don't know what our supplies are based on the current supplies of only a few thousand per week. It is going to take months to get through the list. But that doesn't mean people aren't getting vaccinated, right? People are getting vaccinated. It's just not everyone that's on the list. So when that happens, the next step is that you get, if you're using email, you get that email link to go ahead and set an appointment with our scheduling tool, or you get called to schedule that. So that appointment then gives you the time and the details to show up. What right now, everything is at Eastern Michigan University. This is just a quick look at some of the printed material that we've been sharing to try and help people. This is a version of Spanish and English to try and help people understand this information and get signed up. So as I mentioned, this is likely changing right now, where we've been encouraging folks that have a provider with Michigan Medicine or St. Joe's that we're expecting them to vaccinate. That is shifting a bit, but we are still very much working to coordinate that process with those systems. And then it also links you here to our survey sign up and to the phone support if you need that, and lets you know that you will then be in line, and that when appointment is available, you'll get a call or email, and reinforces that supplies continue to be limited. This is just a little bit about the different ways that we're sharing information and working on that. Always room for improvement. And my former life with the health department, when I first started, I was a health educator, specifically in emergency preparedness. So a lot of my work was working with individuals and groups about how to be prepared for things like this. And one of the things that I would always tell people is that communications and efforts to get communications out and whether that information is understood in a crisis, there will always not be enough communication. You know, parts of it will be wrong and it's always going to go wrong, right? So we're definitely experiencing that in real time now. No matter how much we do, it's not enough. And much of the information changes and needs to change throughout as we respond, but one of the big challenges. So some of the ways that we're doing this is, of course, responding to calls and emails and inquiries. We do a lot of that directly. We have a whole team of wonderful folks that spend all day answering calls and emails. And that is included now, of course, most of it is about the vaccination, but over time, it has included a lot of reports about, you know, businesses or folks that weren't properly using masking or reinforcing distancing. It has also included reports of cases in businesses or workplaces so that we could provide that guidance, what folks needed to do to isolate and quarantine. And of course, with the gathering orders and restrictions, it has included a lot of that type of follow-up. We also do, one of my jobs is to talk to the traditional media. So I spend a good portion of most every day talking to local, regional, and sometimes national reporters to try and make sure we're providing the most up-to-date information on those channels if folks get their news from the TV or online sources or some of the local newspapers. And we do news releases to help with that process as well. Events like this is another big part that all of us do, is participating in those as much as we can. We also have a variety of what we call listservs, where we share announcements and updates with, you know, schools, healthcare partners, boards, organizations, as well as our own staff. Our website and social media, we do pretty much daily updating on that, as well as sharing information. And then, of course, working directly with partners and groups. The Rapid Response Initiative that's mentioned on here was an effort we were doing late the end of this last year to really focus in on both giving flu vaccinations as well as talking to people, and particularly some of our more vulnerable communities and communities of color, about vaccination and about concerns that they had moving either with like traditional vaccination or moving forward into COVID vaccination, so that we could really try to shape our information and our response going forward. Like, what are the questions and concerns that people have about vaccination, and how can we be responsive to that? It also enabled us to provide a lot of free flu vaccines this fall and early winter, which was hopefully a very, very good thing. We had really record numbers of flu vaccination, and combined with all the good hand washing and masking and distancing we're doing, might be one of the biggest reasons that we're not seeing a lot of flu circulating this year, because who knew all that stuff worked, right? Okay, so moving forward. So another burning question that we've had is, of course, the variants. We were fortunate or unfortunate here in Washtenaw to be the first area in Michigan to have identified a case of what's called the UK variant. So that first one on the list, the B117. And the concern about that variant is really that it spreads more easily. So anytime we have something that spreads faster, there's a concern that it's going to impact larger numbers of people, and that's going to lead to not only more cases, but more hospitalizations and deaths, and it's going to do it quicker. So a concern about that. To date, right now, locally, we have about, I believe today's update was 39 cases. And so far, those cases are associated with the University of Michigan community still. And there's a lot of work with the university and with the state health department to really contain that as much as possible. So watching that very, very closely. At the same time, we've done a variety, we've done 3 weekends of testing following the identification of that variant locally. And at each of those testings, we have worked with the state laboratory to test all the positive cases for the variant. So far, we only have results from the first of those, which was January 24th, if I have my dates right. And we did not identify the variant in the broader community. However, since that time, there are now a number of counties across Michigan that have identified the variant. So what that is telling us is a couple things. Either it's spreading from other areas already because it's been in other countries as well as other states, or there was possibly undetected variant already circulating. So those are still questions that we're working on investigating. And the take-home message for everyone is really to double down on those strategies that we know work, right? We know that we can prevent and stop spread by using the masking, the distancing, the hand washing, isolation and quarantine, and we need to keep doing those things. The next variants on the list, there have been cases in the US of each of these, the South African one and the Brazilian one. We have not yet seen those detected locally. And the other big takeaway for what we know so far about the variants is that the current vaccines do all seem to be effective against them. So that's an important point and a comfort. Obviously, there's a lot of work and studies still going on to figure out, how much of this is spreading already and what, if anything, do we need to do different? At this point, the guidance is the same, to keep doing what we know can prevent and reduce spread of these. So an important point about that is masking. The CDC guidance remains to have multiple layers of fabric and something that fits snugly. Obviously, don't want anything that reduces your ability to breathe, but something with multiple layers of fabric is recommended. A lot of folks ask about the double masking. That is likely effective and is in line still with this guidance of more than one layer. And this, again, is more critical if we're seeing faster spread. And I mentioned the testing on that one already. So going to pass on that one. I think these are the last few of my slides, and then I do see some hands up so we can get on to some questions. I just want to touch briefly on the state guidance that is still in place with regard to gatherings. Folks are probably pretty familiar with this. At this point, things are mostly open. A few things remain not necessarily open, like nightclubs and water park type things. And there's still guidance if stuff can be done remotely to do that remotely. Gatherings should be kept small and outdoors if possible. And sports and many other things have resumed with precaution. The indoor dining, of course, has just resumed the beginning of February. That's at 25% capacity and with certain restrictions on timing as well as numbers, and still the guidance to collect those names in case there are exposures. This is just a reminder of where we have our updates. Our main web page, the first one that's listed there is, of course, the vaccine one, because that's mostly what we talked about, but washtenaw.org/COVID-19 is the main COVID page, and will get you to all of those other topics. We are active on all of these platforms you see listed, and you can find updates there as well: Facebook, Twitter, Instagram, and Nextdoor. We do keep our phone information recorded so that there is a message that you hear with a general update if you call that, as well as an option to leave a number. We've also started in response to people feeling like they wanted some direct information and not necessarily having to go to the website all the time. We have an email subscription list where the same things that we post on our other channels can get sent directly to you in email, so you don't have to necessarily check the web pages or worry that you're missing something. So with that, I'm going to breathe for a minute and stop talking. And I am going to stop sharing. And I assume there are questions.
We have so many questions, Susan. And a lot of appreciation. People are recognizing what an incredible departure from your normal operations this is and how heroic the work is. So thank you so much. I know that some of the questions we're going to be asking, you've already gone over, but it always helps to hear it more than once. And I hope some of these are repetitive. I'm trying to sort them, but I didn't want to sort them while you were talking. So, so everybody, please bear with me. First of all, I want to ask about a couple of questions at the federal level. What do you know about steps being taken to speed up supply?
I don't know a lot of it, really. And what we're understanding now, that I think we all understand that there was some expectation that there was some reserves of vaccine that were going to be made available. So it looks like that's not the case. So it looks like what we're coming up against in terms of supply, particularly with the vaccinations that are out there already, the Pfizer and Moderna, is a production issue. Like, right, them out there as fast as they can be produced. And so it's really more of a manufacturing question, whether there's things that they can do to step up that part of them. But that looks more like what we're running up against now is just the time that it takes to produce them. Yeah. Of course, if we get another vaccination up and running and available, that will help too and increase the options.
Right. Okay. Somebody asked, I'm going to scroll down here because somebody asked about having read that recently that Michigan was getting a 16% increase in vaccine supply. Have you heard that?
I'd be curious if the person can tell us where they heard that.
Yeah, I'm trying to find it here.
There has been, of course, advocacy. Michigan has been a state that hasn't necessarily received the same level of vaccinations as some other states, and there's been a lot of work at the state level to try and improve that. And folks may also be seeing that the state has now shifted to using what's called a social vulnerability index to try and help deliver vaccines where there's the most need and likely the most impact already from COVID. The way that that's being used at this point has us in Washtenaw combined with a region that includes Detroit. So that means that Detroit is seeing an increase of vaccines and entirely seeing how that has now allowed them to open up to food workers and open up to the earlier groups. That does not translate into an increase for us. So while there's reasons for using that social vulnerability index, the way that it's being used by region right now does not particularly favor Washtenaw.
Okay. Along the social vulnerability axis, teachers seem very high. And somebody asked about where are teachers on the list, and shouldn't teachers be, and I know the state makes a priority list, right?
Right.
Yeah. Okay. So, somebody's saying, shouldn't teachers be higher than, people my age, people over 65? So what are your thoughts about how the priorities are set, and, are teachers considered frontline workers, and where are they in line?
Well, if we go back again, looking at those groups, the groups that were opened up more widely starting in January 11th included that everyone 65 and older, and it included teachers in that essential. They were one of the essential workers.
Okay, good.
So on the surface, teachers are eligible, as are folks that are 65 and older, right? So it's not so much a matter of prioritizing one over the other. is that there is just simply not enough vaccine to vaccinate everyone currently eligible.
Right.
Eligible doesn't translate into vaccine appointments right now. That said, we are fully aware in Washtenaw that we have both very large numbers of healthcare workers that has set us a bit back in moving through the groups. We also have, I believe, the third largest group of educators and childcare workers in the state. And that also means we have this very large group, right? So we're kind of getting double whammied in terms of large groups, but not necessarily the vaccine supply to meet that demand.
Right. Okay. Somebody put in the chat that Michigan Medicine said today that their vaccine supplies have been cut and that qualified Michigan Medicine patients should contact the health department. Were you aware of that? And
I'm aware that they're saying that, yes. And that's kind of what I was alluding to by the way that we had set up the vaccination between the health systems and the hospitals. We all expected the health systems, particularly Michigan Medicine and St. Joe's IHA, to be able to vaccinate their patients 65 and older. However, as the state has reconfigured how they're allocating vaccines, they're moving toward shifting supply away from the health systems. That is very recent. And we're trying to work with them and figure out how best to move forward. So yes, our premise in our survey had been based on the assumption that people with providers at Michigan Medicine and IHA and St. Joe's would be more quickly served through their healthcare systems. However, the allocations are not following along that way. So that does mean that we will be likely shifting folks back into our priorities. However, based on the number of vaccines that we're getting, that's just going to increase the wait time for everybody. So that's frustrating, absolutely, across the board.
right.
We are working very hard to advocate for increased doses. And one of the things that we're doing is making that appeal very jointly with our health systems and saying, look, we have the capacity to work together to get all of these doses into this very large number of eligible folks very quickly. We just need
Right.
to do it.
We just need the doses.
Right. So that is absolutely changing right now. And I'm afraid I don't have lots of smart words to tell you how it's changing or what we'll do, but we are aware of it. And the state has said, they intend to shift more of the vaccine to health departments. And they've been using like a 60-40 split and some of these kind of percentages things. However, that doesn't really tell us much if we don't know what the numbers are. And at this point, we don't know what the numbers are.
Yeah. So you had said, I believe one of your slides says that we are getting about 3,000 doses a week.
A week at the health
Correct.
Yes.
And that's to the health department. Then St. Joe's would have a separate supply. Michigan would have a separate supply. Is that right? Is that how it's been working?
That is what has been working.
Okay.
However, in this week, I believe is, and I'm not sure, but the supplies that have been going to the health systems have been drastically reduced from what they were. So
By the state, that's a state decision?
correct. That's
Okay.
a state decision. So the person that was referring to the Michigan Medicine now saying that they don't have any first doses is, I believe they got some for second doses, that already needed to be given. But this, I think maybe one of the first weeks that they didn't have capacity to give first doses.
First, okay.
So that's been declining supply at the healthcare level, yes.
Everybody's scrambling like crazy then. And people are, I sense people are getting a little panicky.
A lot of frustration, and
Right.
we feel that too, because our expectations of how this was going to roll out in terms of who was going to be supplied are very much changing right now as well.
Every minute. I mean, you said it was you're building the plane as you fly it, and then it suddenly goes into warp speed while your hammer's in midair.
Something like that.
Yeah. So on the panic button front, I know a number of people are signing up with more than one possible provider. They go to public health, they go to Meyer, they go to, they go everywhere, they go to Walgreens, they go everywhere they can think of and get on the list.
Right.
How's that work for you?
That is a tricky one. And, this messaging around our expectation of someone that has a healthcare provider being able to give it there was trying to help with that. But in good conscience, we can't tell people not to get on multiple lists because we don't know where you're going to get a vaccine first. We are, in fact, seeing the impact of that now as we have a greater proportion of appointments not getting accepted and filled or canceled. So, in the first weeks of clinics, we had, absolutely zero no-shows.
Right.
Nothing like that happening. We are starting to see a greater proportion of no-shows, and we're assuming it's because of that, right?
Yeah, right.
On their vaccination somewhere else, so they're not accepting the appointment or not showing up.
Does that lead to wastage of the vaccine?
It does not lead to wastage.
Good.
We're very, very careful about that. And so first and foremost, we try to account for it with the appointments. And if, the appointments, and then they can kind of control whether or not they're reconstituting vaccine, right? So if you don't have more people showing up, then you don't reconstitute more. If there are doses that are drawn up that have to be used at a clinic, then we do make sure those are used. And we do that from our same lists, right? We start through and get somebody, that we can get that vaccine into. So we don't waste any doses, but it does make the process a bit more difficult than if everybody showed up that had an appointment. So
yeah, right.
Just another logistic that we have to deal with.
I'm sure that telling people not to do that would have no effect.
Not get on multiple lists.
Yeah.
Yeah.
Yeah. I mean, people
we can't, right? Because we assure people that we're going to be able to serve them before the pharmacy list or before any other list that they may be on.
Yeah.
And in fairness, many people do try to let us know, but with the hundreds of calls and emails we get a day, we can't necessarily translate that and get that information to the clinic. So
yeah, and so it's interesting. So there's not one central list, like when you have a line at the store and everybody goes to this one place and then they go out like that. There are all these different separate lists that don't necessarily communicate with each other. So when you sign up on one list, another list doesn't know you've signed up.
You mean like from different providers?
For instance, yeah, there's no central list.
Right. Wouldn't that be cool?
Yeah, wouldn't it?
Yeah. So yeah, at this point, if you're signed up, for example, with Meyer for a pharmacy vaccination, or you're a Michigan medicine patient and you've also subscribed to our list, those lists do not cross-check each other.
They don't talk to each other. Yeah. So somebody asked, I'm going to check the time. Okay, we're good. Somebody asked, how can you know that you're even on the list to be contacted? And hang on. And how do I help aging relatives with the process? Are they already on a list? And how will they get notified? And I think, let me see if I listened well enough to answer this myself.
Oh, it's a test. Yay.
It's a test. I don't know why I'm doing this to myself. But so if you're a regular patient of one of the medical systems around here, you're on a list. And you'll be contacted by the medical system when your number's up. Is that right? If you're a regular patient. Okay. All right. So you just
dwindling supplies at medical providers aside, but yes.
Yes, right. When the supply is available and you're on the list, then then your number's up, then you get contacted. If you are not a regular patient of a provider around here, then you contact the health department. And if you if your group is coming up, you can get on that list and then you'll be contacted about making an appointment. If your group is not coming up yet, they'll say call back later.
Yeah, the way the health department list is set up at this point is there's that brief survey. So if you're eligible, that's what that survey is looking at. It's just a few questions, right?
Right.
So if you complete that, ding, ding, you're eligible, you're on the list, right?
Right.
Nothing more complicated to do there. Then if you've provided an email, then that is how you will get contacted. If you did not provide an email, then we will call you. And so if you're a call or an email when an appointment is actually available. Of course, one of the big challenges, both for us and for people on that list, is that it is taking, weeks or more to get an appointment. So then people feel very worried that they're not on the list, right?
Yeah, that their name dropped off or something.
Right. So
Right.
if somebody has assisted you over the phone to complete that, or if you completed it and got your email confirmation, which sometimes go to junk, then you are in fact on the list.
Okay.
The way that our systems are right now, it is impossible for us to tell you where you are on that list. And we know
But you could call and say, am I on the list? And you can look them up and say, yes, you're on the list.
yes, we can verify you're on a list,
Right. Okay.
but we cannot tell you, when.
Yeah, you can say you're on the list, you're
They're huge teams.
3,712, yeah,
Right.
page, yeah. Okay, and so to help an aging relative, you just call and register them in the same way that you would with
Right.
yourself.
If you are able to just do that for them online, do that.
Right.
If not, then they can call us or they can call 211, or you can complete it for them and either use your email or just put their phone number so that it triggers a phone call to them.
Yeah. Okay. Wonderful that you can do this through 211. That's incredibly helpful.
Yes.
Yeah. Wonderful. Okay. Scrolling through the questions here. So I asked something that's not, so somebody has a primary care provider who is unaffiliated with one of the major institutions. So how's that going to be handled?
So right now we're in, again, going back to this like illustration of kind of emergency mode vaccination, right? Those are the providers, the health systems, pharmacies, the health department. We don't know timing wise when anybody else will have vaccine. So if you have a private practice that is not in one of those, then you should go ahead and get on the health department list, right?
Okay.
Expect, like, the plan is that as supplies increase, more providers will be brought in. So providers have the opportunity to register to be a provider with the state, right?
Okay. Yeah.
In theory, that'll all start happening as we have more supplies. We can't say when, but your provider, for example, could tell you if they've registered or not to be a provider. So then you at least know, yes, my provider, when vaccine is available, will have it, or no, they don't intend to provide it. When that'll happen, the way things are going is probably months and months off. So we're really looking at those emergency models and emergency rollout providers. So if you don't have those hospital-based providers, then it's probably a good idea to go ahead and get on the health department list.
Okay.
Pharmacy list. And if that changes, go ahead and get it somewhere else.
Yeah. Okay. That's great to know. So this person or anybody who is with a private practice can just get on the health department list, call 211, or call your provider and say, are you going to be able to provide vaccines, and then get on that list or get on the health department list.
Right. Or the pharmacies.
Or the pharmacies. Okay.
And the pharmacies right now are the option, of course, for 65 and older, but not necessarily for essential work.
Okay. Okay, let's see. What else do I have?
I think I saw a question pop up about IHA versus St. Joe's, but I
Okay.
read it fully, but
Okay.
maybe
Somebody, hang on a second. Let me see if I can find it.
I think part of the question might have been about St. Joe's versus IHA, because St. Joe's is essentially wrapping up the vaccination they've been doing for frontline healthcare workers, and they're joining us at EMU in a staffing model. But IHA, as their provider group, is continuing to provide some patient vaccinations to 65 and older. So a little bit of a distinction there between IHA and St. Joe, even though they're affiliated.
Okay. Somebody says, if you're a patient at U of M or St. Joe, you should have already been contacted by email to tell you that you're on a list for eligibility, but just wait, right? That's what happened for me too. Okay, let me get back to my list here. Do you have any role to play in trying to convince reluctant healthcare workers to get vaccinated? I mean, we've heard that some 25 to 30% of healthcare workers don't want to be vaccinated. Do you have a role to play with that?
I think we have a role certainly in that education and encouragement. It's been a tough role to play because we're so inundated with folks that are ready and willing. Like, I think before a vaccine was ready, a lot of our conversation and planning was around that, like trying to make sure we could provide good vaccine information, and we could focus on what we often call vaccine hesitancy, and that we could be a reliable source of information for that.
Mm-hmm.
As things have unfolded, especially where we find ourselves right now with very, very low supplies and very, very high demand, it's really challenging for us to spend much time on those topics. Because of course, when we start to do that, people are like, well, but I want to, right?
Mm-hmm.
But that said, we do try to play that role. And I think one of the things that we're seeing is not even so much that folks are so much that they have questions, but they might be what we call not early adopters, right? So the vaccine was first offered, let's say in the healthcare setting is a good example, because they were, right out of the gates, the first ones, right? So if you were someone that was like not all gung-ho and you're just kind of like, okay, I want to take a minute, I want to think about this, then as the vaccine is rolled out, as you're seeing the results, as you're not hearing big safety concerns, we are hearing from people, then they're like, well, okay, I'm ready now, come back to me. So we are hearing that from some of our healthcare providers. So some of it, I think, is really not what we might call, definitely not what we call true anti-vaccination, but not necessarily an early adopter, maybe needed a little bit more time to think about it. We are definitely hearing that from some of our providers, that especially some of our smaller providers, where they were able to vaccinate, their staff in the beginning, but they had some people that said no, and now they're coming back and saying, okay, we had some folks that were not sure at first, but now they want to be vaccinated. So we are definitely seeing more of that.
That's great. That's great to hear. That's wonderful. So, everybody should really just take a deep breath and just plan on, so sorry.
Me too.
Yeah. Everybody just needs to take a deep breath and plan on a long wait. And I'd like to, point out that my husband's a physician, and he's had both doses, and he still wears his mask, and he does all the preventive stuff anyway, because of variants and because we really don't know. So we're going to be masking up for, and washing our hands and all of that for quite a while, even after we've had the vaccination. So
Absolutely.
yeah.
And
so
we really get large proportions of the population vaccinated, we can't count on it not spreading, right? We know it can spread without symptoms. We know it can spread with mild illness. We're going to have to keep using all those tools in our toolbox.
Right. So the vaccination will be wonderful when we get it, and we'll be okay until we don't, most likely, if we keep up these precautionary measures.
One of the things I like to emphasize about vaccination is, and I say this a lot when we talk about flu vaccination,
Yeah,
is that it doesn't, it's a medical intervention, right? So it's not 100% effective. These COVID vaccines, the efficacy on these COVID vaccinations are some of the highest of any of our vaccinations. So that's really good news. But first and foremost, when you get vaccinated individually, what is a success for that vaccine is if you should get sick, that you don't become seriously ill and that you don't die, right? If it's doing its job there, it's preventing you from serious illness, it's preventing you from dying, it's doing the best case scenario, it's doing the best thing,
right,
hope, right?
right,
Doesn't mean you won't get a mild illness. It doesn't mean that you're incapable of passing it to someone else. And we need to remember that.
right, right.
We want that individual protection. We want to prevent the most serious harm, but we still have to be mindful that spread is possible.
Right. I mean, I think that, we're so, I mean, and I say we, meaning the public, but you, the health department staff, even more so, we're so tired of this pandemic and we just so desperately want it to be over. And the thought that a vaccine is on the horizon is really so helpful and exciting. And we just all have to kind of readjust expectations and think, okay, yeah, it's on the horizon, but it's going to be a while and it's not over, but we've got a light at the end of the tunnel.
And that I think is one of the big difficulties too, with this feeling of it's here and I want it so badly and I'm eligible.
Yeah.
That's so hard to rectify right now with the limited availability.
Yeah.
We feel that too. And we so we want to vaccinate everybody who wants right now.
Of course.
It's very, very difficult. All the way.
Yeah. It's really such I mean, this is a wartime mobilization, really.
Right.
And it's right. And that doesn't happen in 2 weeks or 3 weeks. So yeah. Okay. So everybody, sorry?
Or 2 months.
Or 2 months, right? So everybody just needs to find their favorite meditation app and chill. I have a wonderful question here. Oh, well, actually, one quick thing. You had mentioned that one of the preventive measures is to eat only with family, like with a close bubble. That's always felt safest to me, for sure. And somebody asked if it's safe to do food takeout services.
We have not seen, although it's theoretically possible that spread can happen on surfaces and in food, we have not seen evidence of that. So I personally, in my household, big fan of takeout.
I bet.
Doing a lot of cooking around here. So I, speaking for myself, I don't have concerns of takeout, and I do feel good if I can support also some local businesses doing that. But bottom line is we have not seen evidence of that being any sort of a primary route of transmission. That's good news. And of course, hand washing is always critically important when, you're preparing food or you're getting ready to eat food, because that can really eliminate, if there is some small chance of surface contamination, but you're doing a good job with that hand washing, that's another measure of protection.
My husband told me recently that something that I hadn't been paying attention to at all is that after you've been out and shopping or whatever you're doing, and you wear your double masks, which is what we're supposed to be doing now, before you take your mask off when you get home, sanitize your hands because you're touching your face. So that was useful.
Yeah, that's a good, we have, that we get a lot of questions too about the types of masks and the quality of masks. And certainly there's a difference between what we call the medical grade and what we as the public is really being asked to use. And part of using that medical grade is that training, that you're talking about, right? They need to get the effectiveness that is looked for there. You also have to be trained on proper use and fitted.
Right.
it's a fair point, right? If you're out and about touching everything, and then you're going to touch face and take off your mask,
Right.
make sure you're cleaning that. Just like we're, conscious of keeping our masks clean and usable, we also want to make sure that we're touching them with clean hands.
Right. Okay. I want to ask you just in a general way, and I think that we've probably already covered it, what individuals can do. And that's, take all the precautions and take a deep breath and let friends and neighbors and colleagues know that it's going to be a while, and just, send lots of love to your county health workers and everybody else on the front lines.
Yes.
Anything? I'm sorry.
Definitely. And that is such a hard part. And we know it's a hard part that what we can do hasn't changed. It's really doing those things that we know prevent and reduce transmission, and doing them to the best of our ability.
Yeah.
And as you mentioned, if that includes, that generally includes avoiding crowds and gatherings.
Yeah.
But if you are going to gather with people, keep it small, keep it as tight as possible, and be conscious that there is some risk involved in that. So to be alert to that possibility.
Yeah. Okay. Somebody asked if there are ways for volunteers to help the county's COVID response.
We love volunteers. We have been taking volunteer applications, and we have many, many volunteers involved in our ongoing vaccination efforts.
Wonderful.
As of this week, we have been so inundated with new volunteers that we did have to close the process for now. If it should open back up, there is a place on our website that you can go and see that it's under our COVID menu, as well as on our top menu where it says volunteer in an emergency. So should that open back up, you could see that information there. But right now we are very, very chock full of volunteers, which is absolutely wonderful, because what that enables us to do, for example, at the clinics, like all of us are working at the clinics, regardless of what other roles we have. So we're doing that at least a couple of times a week. And so we staff them moving forward each week. We fill in with our staff so that we know that we're staffed and ready to run. And then we backfill with our volunteers, and then keep, a certain number of staff at every station. So that's been a tremendous relief to have so many willing and able volunteers now step forward, because that's fewer staff that we have to have at each and every clinic.
Yeah, that's wonderful. So people who want to volunteer should check the website every week or two to see when spots are available again.
Yeah, I would check back. Well, and since it just closed now, I would, probably not bother to check back for a couple of weeks, but maybe in a couple of weeks, check back and see what that's looking like, if we've been able to open that back up.
Okay. All right. Thank you so much for joining us and helping us understand this, and for all of the work that you do.
Thank you. I appreciate being here and hope it was helpful.
It was very, very helpful. Thank you. Everybody breathe.